Acute bronchitis basically refers to an acute inflammation of the bronchial mucosa, and it is often found in association with upper respiratory tract infection. Most cases do not require antibiotics, but they may be prescribed if the patient's SpO2 is less than 92%, or if there is an underlying comorbidity like malnutrition, measles, rickets, anemia, diabetes mellitus, chronic bronchitis, or HIV, AIDS. The causes are viruses, for example, influenza virus, coronavirus, and common cold. Bacteria, for example, streptococcus pneumonia, Haemophilus influenza, varicella, catarrhalis, staphylococcus aureus. These tend to cause post-influenza chest infections, including bronchitis. The symptoms are dry cough, sputum production, sore throat, pleuritic pain, pleuritic chest pain, low-grade fever. The signs that are usually elicited are fever, rhinorrhea, bronchi, or wheeze. Crepitations are regular, and investigations are FBC, sputum culture, and gram stain, sputum, AFBs, 2 samples for tuberculosis if symptoms have lasted more than 2 weeks, and sinus X-ray for rhinosinusitis with post-nasal drip as a possible cause for prolonged cough. So the main treatment objectives are to relieve symptoms, to treat suspected bacterial infection, if any. As non-pharmacological treatments, bed rest, oral fluids to keep well hydrated, humidified air or steam inhalation if necessary. Pharmacological treatments, uncomplicated acute infections. First line treatment, give paracetamol oral in adults 500 milligrams to 1 gram 6 to 8 hourly. In children 6 to 12 years, give 250 to 500 milligrams 6 to 8 hourly. And 1 to 5 years, give 120 to 250 milligrams 6 to 8 hourly. In 3 months to 1 year, 60 to 120 milligrams 6 to 8 hourly, or paracetamol rectal. In adults, 500 milligrams to 1 gram 6 to 8 hourly. In children 6 to 12 years, 250 to 500 milligrams 6 to 8 hourly. And 1 to 5 years, 120 to 250 milligrams 6 to 8 hourly. 3 months to 1 year, 60 to 120 milligrams 6 to 8 hourly. For uncomplicated acute infections, for irritating or chesty coughs, you give guaifenesin containing expectorant oral in adults 200 to 400 milligrams for hourly. The maximum dosage of 2.4 grams per day. In children more than 12 years, give 100 to 400 milligrams for hourly. The maximum dosage of 2.4 grams per day. And 6 to 11 years, give 100 to 200 milligrams for hourly. And the maximum dosage of 1.2 grams per day. And 2 to 5 years, give 50 to 100 milligrams for hourly. The maximum dosage of 600 milligrams per day. And 6 months to 2 years, give 25 to 50 milligrams for hourly with a maximum dosage of 300 milligrams per day. Or simple linctus oral in adults as adult formulation, 5 milliliters 6 to 8 hourly. In children as pediatric formulation, 1 month to 12 years, you give 2.5 to 5 milliliters 6 to 8 hourly. Or carbocysteine oral in adults, 500 to 750 milligrams 6 to 8 hourly. In children, 2 to 5 years, he gives 62.5 to 125 milligrams 6 hourly. Less than 2 years is not recommended. In uncomplicated acute infections for non-productive or dry cough, he give dextro bitofan containing cough preparations. So for dextromethorphan, in adults we give 10 to 20 milligrams 6 to 8 hourly. In children 7 to 12 years, 50 milligrams 6 to 8 hourly with a maximum dosage of 60 milligrams per day. And 4 to 6 years, it gives 7.5 milligrams 6 to 8 hourly with a maximum dosage of 30 milligrams per day. And less than 4 years is not recommended. You could give codeine containing cough preparations in adults 7.5 to 20 milligrams 4 to 6 hourly as needed. The maximum dosage of 120 milligrams per day. And in children 7 to 12 years, you give 1 to 1.5 milligrams per kilogram per day in 4 to 6 divided doses. The maximum dosage of 60 milligrams per day. And also 2 to 6 years, you give 1.1 to 1.5 milligram per kilogram and per day in 4 to 6 divided doses with a maximum dosage of 30 milligrams per day. Less than 2 years is not recommended. For complicated acute infections with comorbidities or secondary bacterial infection, first line treatment, you give amoxicillin oral in adults 500 milligrams 8 hourly for 5 to 7 days. And in children 6 to 12 years, you give 250 milligrams 8 hourly for 7 days. 1 to 5 years, you give 125 milligrams 8 hourly for 7 days. And less than 1 year, you give 62.5 milligrams 8 hourly for 7 days. Or you could give amoxicillin plus clavulanic acid oral in adults 1 gram 12 hourly for 5 to 7 days. In children more than 12 years, give 500 1 to 5 tablets 12 hourly for 7 days. And 4 to 12 years, 5 milliliters of 457 suspension 12 hourly for 7 days. And 1 to 4 years, 500 milliliters 5 milliliters of 228 suspension 12 hourly for 7 days. So 3 months to 1 year, you give 20 milligrams per kilogram of amoxicillin 12 hourly for 7 days. Less than 3 months, you give 50 milligrams per kilogram of amoxicillin 12 hourly for 7 days. For children, double the dose of the above antibiotic. So you double the dose of the antibiotics in severe infections, for example in bronchopneumonia. Or you can give erythromycin oral for individuals allergic to penicillin in adults 250 to 500 milligrams 6 hourly for 7 days. In children 8 to 18 years, you give 250 to 500 milligrams 6 hourly for 7 days. 2 to 8 years, 250 milligrams 6 hourly for 7 days. Or 6 months to 2 years, give 125 milligrams 6 hourly for 7 days. Or can give azithromycin oral in adults 500 milligrams once daily for 3 days. In children 10 milligrams per kilogram once daily for 3 days. And also oxygen by nasal prongs 2 to 6 liters per minute, or face mask 4 to 8 liters per minute, or non-rebreather mask 10 to 15 liters per minute. So referral criteria: refer all complicated cases of acute bronchitis to a specialist.